YouTube, channel DZRJ 8:10 a.m. Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗥𝗏𝗽𝗵 as we discuss the latest health and medical topics with doctors from 𝗥𝗏𝗽𝗵. For a healthier and uplifting lifestyle, tune into Healthline with 𝗥𝗏𝗽𝗵 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗥𝗏𝗽𝗵, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗥𝗏𝗽𝗵 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗥𝗏𝗽𝗵. I'm your host, Nicole Jacinto. Today with us on the program, we have Dr. Marian Priscilla Quek. She's an infectious disease specialist, and we're going to talk about HIV and AIDS. So good afternoon, Dr. Quek. How are you doing?
Good afternoon, Nicole. Thanks for having me back.
That's great. I'm glad to have you back on the show, and I'm glad we're going to discuss this topic. I hope that it can serve as a platform to keep all of us more informed, or for those of us who know about, who maybe think we know a lot about the topic. You're here to refresh our, it's like a refresher course, and it does concern a lot of people all over the world. It concerns a big population. And even if you're not afflicted with a disease like with HIV and or AIDS, then it's still something to learn about, because you might know some people who are, or you might want to perhaps find ways to prevent getting the illness or the illnesses. Okay, so doctor, why don't we start with the acronyms, HIV and AIDS? So can you tell us first what HIV stands for?
Yeah, so HIV stands for Human Immunodeficiency Virus. And this is the virus, if unchecked or if untreated, can lead to AIDS, which is Acquired Immune Deficiency Syndrome. So from the name itself, the immunodeficiency or the immune suppression, meaning mahina ang resistensya, is because of this virus.
Yes.
And it's human.
Sorry, go ahead, doctor.
Yeah.
Oh, sorry, go ahead, doctor.
Yeah, that's it.
Okay. So, mahinang resistensya. So, of course, a lot of Filipinos who understand that mahinang resistensya, it's basically our immune system, which fights off illnesses and diseases. Sometimes very simple things like a cold or a cough or some kind of infection, it's weakened. No, there's something, as you said, it's in the name itself, deficiency. There's a deficiency in our autoimmune system. So, doctor, when it comes to the virus, you think HIV can cause AIDS. So, if you contract HIV, does it necessarily mean that you will get AIDS?
No. It's in fact one of the things we have to emphasize as a takeaway after this show. Not everybody with HIV will progress to AIDS, because with timely treatment, people who have the virus can have no immune deficiency for as long as they are maintained on the proper treatment. And AIDS is something that you can acquire if you are not on treatment.
If you're not on treatment, okay. Does it? If HIV is left untreated, does it always progress to AIDS, or are there cases where it doesn't, where you found people who, well, I guess like they, for some reason, like in studies, they found out they had HIV, and then it never progressed to AIDS even if they didn't get treated.
Yeah, generally, so those are exceptions. Those are rare cases where people can have mutation where their progression to AIDS is not as fast compared to the general population, but it's not a general rule. So for the general population, all people who will have the virus of HIV will progress to acquired immune deficiency state. And it's important, that's why we are emphasizing early detection, because same thing with cancer, it's easier to treat a person with an early stage cancer compared to someone with an advanced cancer. So very important, emphasize that.
Okay, thank you, doctor. Now, if somebody is infected with HIV, a patient is infected with HIV, would they notice, could they go for years without noticing any symptoms or feeling normal, or even perhaps, still be playing sports, like playing sports, being athletic, or doing what they normally do and not having any of the symptoms? And then maybe we can go to some of the symptoms in a bit.
It's true.
Yeah.
It's true, no? The patients can have a long period of latency where they feel fine and they don't have any symptoms. Usually what we tell our patients when we discuss these things is when you are already exhibiting signs and symptoms like recurrent infections, it usually indicates that you're already in a state where your immune system is already very down or deficient, so that you are getting all of these symptoms already. For the most part, you can remain asymptomatic for years. Some can have a latency of as early as 2 years, but there are those who can remain asymptomatic for even as long as 10 years.
10 years.
I would tell my patients it's like hypertension.
Yeah.
You can have high blood pressure but not know it. When you will have the symptoms, sometimes you go to the annual checkup in your office and then they'll measure a BP. You're at 180 and you're not feeling anything. So the only way for you to know you're hypertensive is if you measure your BP. In the same manner for HIV, the only way for you to know is by doing the HIV test.
The HIV test. Okay. Is the HIV test, is that the only diagnostic tool that you use to diagnose someone who has HIV, or do you use other tools or equipment as well?
Yeah, the general screening would be an HIV screening, which is a blood test. There are also self-test kits that are being provided by DOH in collaboration with different HIV primary care centers, where you can do a home kit. It's like you get a prick of your blood and then you can do a home kit, home testing. And there's also like salivary tests or swab tests that they can do. There are also test kits for that, but it's not part of the national program. What we're using is the self-test kit with the blood. And then there are also PCR testing where we measure the HIV virus in the blood. So parang COVID PCR, but it's HIV PCR or viral load, and we use a blood sample instead of a nasal swab.
Okay. So basically, it takes some blood. You need to test the blood. And when you go for let's say to get an HIV test, you'll just take some blood, draw some blood from the vein inside the elbow, something like that. Now for the home,
those are for the lab, Nicole, but for the self-test kit, it's just a prick.
Just a prick.
Parang sa sugar.
Yeah.
So prick, and then there's a certain amount that you would collect.
Well, sometimes
like a prick of blood.
when we discuss like right now what actually causes you or what can infect you, the causes of infection with HIV, sometimes it's just a little prick as well. Okay, so okay, how do you contract HIV?
So the most common route of transmission is sexual contact, whether it's a male to female or male to male partners, female to female is less. But for our local epidemiologic data, it's male to male contact that has the higher incidence in our country compared to other parts of the world where it's heterosexual contact that's the higher route. And then, of course, since the the body fluid that can carry the infection is blood. So anything that involves blood, so like for healthcare workers, for example, where you can have blood or body fluid exposure/injuries or even needle stick injuries, that's also one way that you can acquire it. And then also mother to child or vertical transmission. So you can be transmitted in utero in a mother who has HIV and is not on treatment, and they can transmit it to their babies. And if the baby is unable to get the preventative treatment as well, then that's one way to acquire it. Other is through breast milk. So those are the means to acquire it. You can't acquire it. You can't. So cannot, just to emphasize, you cannot acquire it from casual contact, from hugging, kissing, shaking hands. So it's very important that we emphasize it, because a lot of people with HIV face stigma, and even some people are hesitant to touch them. So I want it to be clear that you don't get it from casual contact. So they need the the body language of providing support, like hugging or kissing, just so they know that you're there. If you have a relative or if you have a friend who has HIV, feel free to hug them because they need it. No, so you can't acquire it from that.
We'll break it down. I'd like to break it down a little bit more. As you said, like if you're a medical professional and let's say, you're taking blood from someone or you're trying to put an IV in them, and then you accidentally, you say you're not wearing gloves that are thick enough, you accidentally prick yourself. Told you, it just takes a little prick sometimes. That is a possibility that you will get HIV. Yeah. Okay. And then for, let's say, blood transfusions, although...
Yeah, I forgot to mention that.
We have to just, I know they're safer now because I don't want to scare people away from blood transfusions.
Yes.
It is...
Screen that, and before, when they didn't understand how HIV was transmitted, that was one route that HIV was transmitted before. But now it's standard to test not just for HIV but for other infections like hepatitis B, C. We screen our blood also for that. So if you are supposed to have blood transfusion, lalo na ngayon, uso din ng dengue, no? So be assured that the blood is screened, and there are safety measures. All hospitals practice certain standards when preparing blood for transfusion.
Okay, thank you, doctor. And also, let's say, I know before this was a thing, like if you're a drug user, well, let's say you inject heroin or something, shared needles, or...
It is. It is still in some parts of the Philippines where the incidence of IV drug use is high. Yes, that's another route of transmission.
And also perhaps before, doctor, where, people would just reuse needles, like, and maybe some people were not very, like, I guess in an emergency situation, maybe they didn't boil the needle. Oh, okay, let's say, question for you. Let's say you used a needle on someone and you had to use it on someone else for some scenario. The same needle, it's not a disposable needle. If you boil the needle or clean it, will that lessen the chances of getting HIV?
Yeah, we don't use yung mga needles that we usually use single use already. But let's say for the sake of argument that using the old needles use, so sterilizing it by boiling, that would be enough to kill the virus.
Yeah. Okay, thank you, doctor. And then also, okay, so let's get to the where the stigma comes from. I think mostly for our culture is not even the needle use or all of these things. It's the sexual contact. Or people having sex, no? It's just the whole idea of it. As you said, there is a stigma. And let's try to clear that up a little bit about how you contract HIV. There's sexual contact, and then also as you said, the transmission between mother and child. Okay. So when it comes to sexual contact, you mentioned that in the correct me if I'm wrong, in the local profile or in the Philippines, around the world, okay, so around the world, it's a lot of heterosexual sex, so male and female. And when it comes to the local profile, it's more male to male. Is
Yes.
that correct? Okay, so that's what you've seen happening in the country. Um, why why do you think that's the case? Do you think that people are just undiagnosed when it comes to heterosexual relationships, or
Yeah, so the reports are based on the DOH, the data that's gathered. So that's where we see that we do have patients, more of them having had sex with men, whether
Mhm.
it's purely men to men contact or men who have sex with both men and women.
Okay?
Yeah. So there are a lot of factors that are associated with this. It could be the practice. So these are the possible explanations for it. The practices that some I don't want to generalize it because this does not mean that a person with HIV automatically indicates that they have had sexual contact with numerous relations because it only
Yes.
takes one.
It
And
only
contact,
takes one. Mm-hmm.
yeah, for as long as you are in contact unprotected with one who has the infection, you can acquire it. But the practice could be because of maybe lack of education,
Mm-hmm.
early sexual debut that we are seeing now, and
Mm-hmm.
then you can have the environment that makes it easy for you to engage in such activities casually or even in some cases transactional,
Mm-hmm.
and then you can have more than one. There's really a lot of cases where they do have more than one partners or body counts as they would call it, and then some would have associations with the fact that it's a lifestyle, a
Mm-hmm.
disease of the lifestyle. So people can engage in what we call chemsex, where they use substances that may affect their inhibitions or their reasoning, so they engage in more risky behavior. So
Mm-hmm.
those are some of the factors that we are seeing.
Mm-hmm.
One factor that's also being proposed is because for women, there's the issue of risk for pregnancy. So they tend to use more of the barrier protection, like condoms, compared to those who, let's say, for men who have sex with men. So these are some of the possible reasons that would explain why we see that. And also the route of transmission. When women and men have sexual intercourse, so the anatomy of the female it's designed, no? It's really there is that risk for transmission between men and women, but for men in particular who have sex with men, usually the contact is through anal contact or
Mm-hmm.
anal intercourse. And the intestine is not really designed to expand as well as how a vagina would be for a female. And there are a lot of blood in the area. So
Yeah.
again, blood is a way or a high risk fluid for you to get infection. So
Mm-hmm.
for anal intercourse, there's really high risk, especially the one who is what we call anal receptive, or the one at the bottom,
Okay.
to acquire the infection more because of the blood and the contact time with let's say their partner has the infection. So
Mhm.
contact time with semen will also increase their risk. So these are all possible reasons why MSMs or men who have sex with men have higher risk than the incidence is higher in what
Yeah.
we're seeing. Yeah.
Okay. So when it comes to, let's say, anal sex and anal contact, and some women might have anal sex as well with male
Yeah.
partner. Um,
Mhm.
uh, when it comes to the anus and the big intestine, which is right there, it's usually the person whose anus is penetrated by the penis, and then it's the HIV virus will be in the semen. But is it also because, like, because as you said, there's a lot of blood in the area, like, are there vessels that are
Yeah,
sensitive?
it's very vascular in
Yeah.
the rectum. So yes.
Okay.
Mhm.
So that's why. Okay. And then also, you did mention with heterosexual sex, or maybe women are more concerned about not getting pregnant, so they will use barriers like condoms. And we'll talk about, okay, so let's talk about safe sex. Will a condom guarantee that you won't get AIDS 100%? will using a condom?
I don't think you will see anything in the literature that's 100%, but the use of condoms significantly reduces the risk of you not just acquiring HIV, but other sexually transmitted infections for that matter. So like gonorrhea, chlamydia, syphilis. So the use of condoms over 90%, definitely you can reduce the risk. That's why as part of prevention, if you have high risk behavior, we advocate for condoms plus PrEP. PrEP is pre-exposure prophylaxis. It's a medicine that is given or people with risk can take as preventative for them to not acquire HIV.
So before we get to PrEP, let's still get, I just want to make it clear and clarify and give a better picture. Okay, so there's condoms can help greatly, not just with not contracting HIV, but also with other STDs. Do we still call them that? Or sexually transmitted diseases?
Yeah.
Sometimes.
Sexually transmitted infections.
Okay. So it's not a bad word now. Okay. Okay. So anyway, and then also, let's say, okay, how about oral sex? Okay, let's go. Let me be more definitive. Let's say it's a penis and a mouth. So it's oral sex performed on a male. These are questions that people will think of and freak out about. So, can you get AIDS from that?
You can get HIV from it. It not as high risk compared to the anal receptive unprotected sexual contact, but there is that risk still. We have to remember for efficient HIV infection to happen, you have to be exposed to any of these infectious fluids. So it's semen, vaginal fluid, blood, and breast milk.
Okay.
So in oral sex, especially if there's ejaculation in the mouth, then there will be exposure to semen. That would be your risk for exposure, especially if the one who has HIV has very high levels of the virus that's able to exit the body and enter another host, or another person.
And also, does it make a difference if, let's say, the person performing fellatio or the person performing oral sex on a male with a penis has like a wound in the mouth that they didn't account for?
It will make a difference also, because then you have the mucosal damage where there's a bleed that can be a point of entry for the virus.
Or like some scratch in the throat or an esophagus that's bleeding or some ulcer in the stomach, something like that, no?
Yeah.
Okay.
That's
All
gonna
right.
be a
Okay. Now for but if somebody if the one, okay, so I guess there have probably been incidences where males will wear a condom even for fellatio. Does that help
Yes.
reduce risk?
Actually, that's why there are flavor. There are variations of flavored condoms for that purpose. And
Okay.
even for women, it's not as popular here, but in Europe and other parts, other Western countries, I have seen that they do sell dams. They call it dam.
Yes.
This is a barrier that can be used when it's the woman who's receiving the oral sex. So it's the barrier that you can use.
So for cunnilingus or the woman receiving oral sex, there's a barrier you can put and on the
I
vagina.
think it's locally available. I don't see a lot of it here. I've only seen it overseas.
Let's go
I don't
ask
know.
friends, no? They
Maybe.
probably know. After the show, will be like, hey, do you guys, okay. Yeah. I'm sure some of them know. These probably have flavors as well, and it's pleasurable for the woman receiving and the woman or man who is performing the cunnilingus or oral sex on the woman. Okay, so that can make it safer, definitely. Okay, so as you said, okay, so HIV, the virus will be in bodily fluids like blood, semen, vaginal fluids. Can we talk about something you mentioned before we talk about PrEP? The mothers who are, or females who are pregnant and they can pass it on to the baby. How does that happen? Is it through the umbilical cord, or is it because of the birth itself?
All steps. So whether in utero, during delivery, and through lactation. No, but it's important to emphasize that this route of transmission can also be prevented. In fact, this is one of the things that the HIV program is also focusing on, the prevention of mother-to-child transmission of HIV, because this is something that is doable. No, we do have HIV positive mothers who have children who are HIV negative. And this is important maybe for the listeners out there who may think that the door to motherhood may be closed on them because of their HIV status. So it's not. As long as the mother gets the proper treatment, if they are virally suppressed and then they're properly screened. That's why prenatal screening also in the Philippines would include HIV screening, because this is something where you can intervene. And then during delivery, for the early phase, the children can receive like a prophylaxis also of antiretrovirals, so they reduce the risk of the transmission. So I do have patients who already have children already that are, I think my other patient, maybe 4 na yata yung anak niya ngayon. Yeah, so
That's wonderful. Okay, so a woman, a female who can get pregnant even if she has HIV and not pass it on to her kid through the treatment that you prescribe her. Can you talk about that a little? Because you said in all stages of the pregnancy, it's possible for the child to contract HIV from being in the mother's womb. Can you just expound on that a little bit, or just give us a kind of a
So, in terms of infection, if the mother is not getting the treatment that they should have, then the virus will run unchecked and they will be replicating in their body. And of course, that's something that they can pass on because the baby would be exposed to maternal blood and all that, no? But if they are on treatment, basically how the virus, the antiretroviral or the medicine for HIV works, basically what it does is it puts the virus to sleep, quote unquote. So it suppresses viral replication where you would no longer have enough of the circulating virus in your body. And if you don't have enough of the circulating virus, then there's also not enough of the virus to cause infection.
Okay.
So that's how the treatment would work. And in fact, the treatment of persons living with HIV is also in itself a public health intervention, because the more these people with HIV are on treatment and they are virally suppressed, then they are no longer infective enough to be able to pass on this virus. So you arrest the transmission also by treating someone who has HIV.
Okay, that's great, doctor. And we always think of most people when you say giving birth, they think of natural birth. How about those who get C-sections? Would it be safer for the baby that way, or do you find that a lot of patients with who have HIV, like is it more recommended to get cesareans, or it's both, like the
Nowadays, with the presence of effective antiretrovirals, the indications for cesarean section will follow what would be the standard guidelines for indication for cesarean section as with the general population. So, nakagaya nun, medyo parang ano na lang din, same na lang.
same. Okay, that's really good news from where the world was like 20, 30 years ago when it comes to
Very different environment and climate.
yes. And that's what can happen when people really get behind it and get over their stigmas also, which is probably something we can discuss more later. Also, okay, so we've come to that. Now, what is PrEP? You mentioned PrEP earlier. Okay.
Yeah, so HIV PrEP is pre-exposure prophylaxis. It's a pill. What we have locally is a pill. You take it on a daily there are nuances to how it's administered, but basically it's a pill that you give someone as preventative, so that if they get exposed to the virus, the infection will not establish itself in this person taking the PrEP. So this HIV PrEP is a medicine that can prevent HIV only. So it does not prevent you from getting other infections like chlamydia, syphilis, no? So that's why it's always condoms plus PrEP
Okay.
to maximize the protection.
So PrEP, how does it act? So first it's for people to avoid getting the
Yeah.
HIV.
So
What
you
about
use it for people who do not have HIV yet, but they are at risk. Maybe the lifestyle that they have or their behaviors, like their sexual contacts, can put them at risk. There are people who do engage in casual sexual contact, and sometimes with people who they don't know. So if there is this risk for these, it's not something that it's their lifestyle. So they just have to be smart about it, no? So some people really just take this as a way virus, because this virus is lifelong.
Yes. Okay. So to make it clear to everyone out there, PrEP is for those who are not yet infected with HIV. And it's not someone who has HIV that needs to take PrEP. It's someone who
Yes,
doesn't have it yet that needs
does
to
not have it yet.
not have it yet. Okay, who needs to take PrEP. And you're talking about risky behavior, lifestyle. Earlier, you mentioned some substance abuse that comes along with it. That can happen, and or for people who just engage in risky behavior, meaning probably having a higher body count or having sex with people they don't know, so they don't really know their history.
Mhm.
Or maybe for sex workers, like
Yes.
if that's their job, where they have sex with people as part of their job, then they probably use condoms, everything else, and PrEP. It's probably something like that. Also for people who like to engage in sex with.
Or, for anyone who wants it, for that matter. Because there are people who are anxious about getting or acquiring it, and there are some who really have debilitating fear of acquiring the infection. So, in fact, one of, even those who lecture on HIV PrEP, this is something that you can offer to someone who asks for it. No?
Okay.
So you don't necessarily have to have high risk lifestyle, but if someone wants to have that for themselves as their preventative, it's kind of like vaccines, no? You get vaccines, you want to get the protection. You may not necessarily be going into places.
Woman or the wife should be this way and that way, and it's still prevalent now and should be faithful and all of that, and yet her husband has an affair or goes out one time, sleeps with someone, male or female, doesn't know the history of the person, can come home and give her HIV. So
Yeah.
that
And those are things we really do see in practice, no? Kaya it's, you really, when you take care of people with HIV, dapat the judgment is out the window, because you never know what the circumstances were when they got the infection. And even if you can say that it's a lifestyle illness, you don't go around telling people with diabetes, ikaw kasi, you don't.
yes, that's a great point.
It's a lifestyle disease as well, no? So,
That's diabetes type 2, right? Yeah, you don't go, ikaw
yes.
kasi, you keep eating sugar, you're
Parang
fatty. People say
it's,
that.
yeah, and it just so happened that the route that you get HIV, the most common is through sexual contact. So, especially in our society, medyo it's still taboo. Yeah, I don't know, it's 2024, but it's still taboo to talk about sex. So the
Well, not
stigma.
if you hang out with me. You can talk about it all you want. We're not doing it because I'm not interested in you. You're not, but we can talk about it all you want.
Yeah.
But I understand it's still taboo.
Still taboo.
Even embarrassed
Yeah, it's very heartbreaking because sometimes you do get people who are, starting palang their lives. They're in their early 20s and then they already have advanced HIV. And I think maybe if they had known about PrEP, if they had known about because there are also some who are coerced. So the
Yes.
setting of boundaries, these are things that maybe could have helped prevent, no? Prevent them from getting the infection. That's why we always also advocate for education, and this platform is important so that we can educate people more about HIV, encourage people to ask questions.
Mhm.
And there are those who, I mean, everything's online, but sometimes yung mga nasa online, hindi rin ganun ka-reliable, no? So, we have to direct them where they can look for information and then direct them to different offices where they can access these services. Because
Yes.
there are people who are interested but just don't know how to go about it.
Yes, doctor. And thank you for saying that. Thank you for helping dispel the stigma. And you'd mentioned something which is difficult to talk about sometimes, but you said there are those who are coerced. And there are adolescents, even children, and even adults who get taken advantage of, whether it's rape, a form of sexual assault, something, somebody says, sometimes it's family members seen and dealt with these issues. I mean, an uncle or something, or even cousins molesting their other cousins. It happens, and then, it's not like it was really a full grown up choice for this person who contracted it that way. It's a double whammy. They have that trauma already, but they can survive that. And then, but now they have an illness to deal with. And then here come people judging them. So it's difficult sometimes to talk about, but I had to say that. Makes me sad. Okay. And okay, so talking about PrEP, talking about how do you treat HIV before we get to full blown AIDS?
Yeah, so if they are diagnosed early enough, you can on the day that they are tested, you can actually start them on what we call ART or antiretroviral therapy. So the shift now is early diagnosis and early treatment, no? So before kasi just to put things in context, previously with the older antiretroviral drugs, you had to wait a certain immune level before you start giving them the medicine. But meanwhile, the virus is just replicating in the body and the illness is progressing, and you can have other infections come in before you start giving your ART. So now, especially with the targets, the global 95 targets, we're in by 2030, we want to end the HIV epidemic, and you want 95% of people at risk to be tested. And among these tested and diagnosed, 95% of them should be on treatment. 95% of them should be virally suppressed, meaning undetectable na sila, no? So, it's, ayan, I lost my train of thought na.
No. So it's one of those, it's something that you advocate for, na get early diagnosis.
Yes, because
And
sometimes along the way in that cascade of care, people get tested nga. And then you ask them to come back. Oh, we'll do this test.
but
And
they
then
don't come
come
back.
back after 2 weeks. And then they don't come back. So,
Does it have anything to do with
patient na yun.
expense?
That
Or
was
is it
an
more
opportunity. That was an opportunity to give them the medicine on that day. So ngayon, same day SDART, same day ART. Once they're diagnosed today, ngayon din mag-treat ka na. So that's how there is also a shift in the management of HIV, no? Parang wag mo na siyang pakawalan.
Yes.
Bigay mo na so they can get treated right away provided they have no other infections that
adverse
you have.
reactions, and you can test them for that. You can say, okay, if you're really afraid and you're allergic to some stuff and we don't know how your system will take it, you can stay here first in the hospital. I'll guide you through. You provide support for that as well. Okay. And then so that's important, and that's the reason why we talked about some of the who are at risk, not just your behavior but things that may have happened to you. Actually, I mean, it could come from your husband, your wife, your, people who are supposedly in monotonous, not monotonous, I'm just kidding,
Ano to?
relationships. I like monotony, by the way. So I'm not saying anything against that. Just wanted to make Dr. Quack laugh a little bit. And you guys out there too. Um, so, so those, even if you're in a monogamous relationship, and even if you think, oh, I've been with my husband for 30 years. Yeah, just one thing he did that you didn't know about. There you go. Okay. May hugot ba? Okay. Then, para dun sa iba, I just see a lot of it, okay? That's so nice. Okay.
Yeah.
So, okay. And then, now I'm not going to lose my train of thought. Okay. So the ART, you did mention earlier before, the reason why also that you give it on that day itself, like, nandiyan ka na, wag mo nang pakawalan, give it. Before, people had to wait, and at the same time, their viral load was climbing. It was replicating. Those were the days when it was still being tested, or it was being rolled out slowly. Have you read Angels in America, the play, or seen it, or seen a version of it?
I have not watched it or personally.
Oh, okay. Anyway, that's just the thing. It's quite interesting how there is a version that was put out on TV years ago, I think 90s or 2000s, but very interesting how, from a, not just from an experience perspective of the one who wrote it and the people that he knew at the time, that all of this also comes out, like the whole history of it, and the pain and the stigma. Okay, but so now, okay, it's important to listen to your doctor and take the medication right away. If they don't come back, do you think part of it is expense, or also just freaking out completely?
Yeah, so from my experience at least, there are those who are not yet ready. They're still in denial, which is something that we do see commonly.
Yes.
When you give them you tested positive here, let's confirm it, but they won't come back anymore. Sometimes they'll go to another place and see if it's the same result, no? So they might opt to be tested again in another facility. There are some that expense could be an issue, but if it were expense, we would also refer them. There are centers where you can access these services for free. Even though for example, in the center where I'm at in Makati Med, although we're a private hospital, we do provide access to these services from what the DOH is giving as well. So they do have the free screening kits also, and then the antiretroviral medicines are subsidized by the government, and this is covered by their PhilHealth. So there is a PhilHealth package for HIV, people with HIV. It's called the Outpatient HIV/AIDS Treatment Package. And this is a reimbursable amount of, I think, 9,750 per quarter. So that could go a long way for someone who has it. But yeah, expense is one. So we can direct them to centers where they can maybe have more free services, or we can assist them with their filing. We do have we collaborate with not just DOH but other NGOs like Philippine National Foundation, the Global Fund, where you would have these funding that you can have what we call enablers for newly diagnosed individuals. And then there are the stigma, because patients themselves can also self-stigmatize. So there are those who don't come back because they are
themselves and feeling bad.
There are that's a different session entirely. The mental health concerns of people living with HIV. Aside from the stigma, there's the anxiety, the supply of medications. You're reliant on the government for the access, and minsan when there are shortages, their anxiety levels would go through the roof, and then people can get depressed. It's a reality, no? It's a reality that you have a new diagnosis of a lifelong condition, and mental issues really can be another reason why they don't come back. We do have patients, no? I have a few who were already on treatment, and they were already controlled, and then for whatever reason, maybe a loss of a job, loss of a partner, loss of a parent, or financial issue, and then they suddenly stop coming back for
Yeah.
their treatment. And when they do come back, the disease has progressed again. And it's actually more challenging to treat someone who has had treatment and stopped versus someone who's never had treatment before, because there's the issue of drug resistance already. Because it's a virus and it can mutate,
Yeah, that's right. Because it's a virus and it mutates. So please continue with your treatments. Just try to, no matter what you're feeling, or how you're feeling. And I'm sure doctors like yourself can also refer them to people who deal with mental health issues, like psychiatrists or psychologists, or perhaps there are support groups. I don't know. I think maybe we could use more support groups, but in our culture nobody wants to admit anything. And then sometimes
Because it's another stigma again, no? You have HIV na may stigma, and then you have mental health, which comes with its own stigma too, no? So parang double whammy sila, and you'll have to also empathize with what they're going through, no?
so can we be better, please, as a society? That's my plea for today. I mean, I've accompanied someone to a counseling session, and then they're the ones conducting it had some sort of, I'm sorry to say, but they had some religious whatever. It wasn't Catholic. That's all I'm gonna say, because I have my issues with my own faith. But you know, with my own institutional. I'm Catholic, so anyway. But it wasn't Catholic, and then they felt judged, and I could tell because blah blah blah, and then how can it be like anonymous when do you know who that is? That's ganyan. So what do you do? You're not supposed to ask those questions. I'm like, gosh, I wish someone would just come in here and put up proper, you know what I mean? Set up proper like support groups also for anything, for anything. Okay, so. When talking about full-blown AIDS, what do you give patients who have already, what are the symptoms, even just an overview of that, and what do you give them already?
So people with AIDS, they have signs and symptoms associated with the opportunistic infection they have. So when we say opportunistic infection, meaning if your immune system is healthy, you would not have gotten it, but it's taking advantage of the immune deficiency. So that's why you get sick. So if your opportunistic infection, let's say, is a type of fungal pneumonia, then you can present with shortness of breath, low oxygen levels, para ka may severe COVID, ganon, your CT scans are very bad. And then if your opportunistic infection involves the brain, like meningitis, then you have signs and symptoms of meningitis, like severe headache. Some will not be conscious at the time that they're diagnosed. So the signs and symptoms are varied once you reach that point. And when you're immune deficient enough, you can have more than one infection happening all at the same time. So when you treat people with acquired immune deficiency syndrome or AIDS, not only do you have to treat the opportunistic infection, you also have to wait until an opportune time for you to start the antiretroviral therapy. So unlike the one that I was mentioning earlier, the SDART, where on the community level, yung wala pa masyadong symptoms, diagnose, you start on the same day. There are certain infections where you really have to treat those opportunistic infections first before you can safely start the antiretroviral therapy. And of course, with the more severe illness you have, you'll be in the hospital, probably ICU, then the cost of hospitalization will add up, cost of medications would add up, so these things. So it's really mas cost effective once you prevent. Syempre, prevention is more cost effective, but should you get infected, then early treatment is the next best
treatment. Thank you, Doc. I mean, that's a way to put it. And as you said, opportunistic illnesses. So it's like basically you don't die of AIDS itself, but your immune system is so low that you can get fungal pneumonia, some other type. And then you also got pala cold, and then you
certain
got
cancers also are more common in immune
what
deficient.
type of cancers are more common?
Like Kaposi sarcoma. It's caused by human herpes virus 8.
What is that? Can you just
it can have several manifestations. So you can have skin Kaposi sarcoma. If you watch the movie Philadelphia with Tom Hanks,
yeah, okay. I
lesions he had on the ones that he was showing. I think he was showing lesions of KS or
Lesions, yes. Okay.
So that's a type of cancer, but it can also happen internally. Now,
Mhm.
what we call visceral Kaposi's. And then some lymphoma.
Mhm.
So some people with HIV are at higher risk, or people with AIDS are at higher risk for certain lymphoma. So, which is a
That
type of
because
blood
blood
cancer.
circulating around and you hit these areas. Okay.
So you have to treat that too.
You have to treat that. You have to treat you have to treat other symptoms.
Mm-hmm.
Okay. So, all right. Doctor, what do you is there anything sorry, okay. So AIDS will so some of the takeaways from this are if you have HIV, it will progress. It could take years, but it will progress. Can you tell us what we already mentioned some of the specific challenges that people who have AIDS or HIV face. What about families and caregivers and those supporting those with AIDS? Is there something you'd like to tell them, or what should they know? And then after that, let's talk about the more general public and the stigma and what message you have for them in terms of prevention of AIDS and just anything. Okay, let's start with the families and caregivers.
So
Sorry,
for
a
the
lot of
family,
ones.
yeah, for the families and caregivers, if you're afraid to take care of someone because of you're considering your risk of getting infected, usually when a patient, let's say they have AIDS, mas may chance pa nga silang makakuha ng infection sa'yo. Kasi ikaw, you have that immune system to fight off infection. They don't. So you can have a cold and then they'll develop pneumonia because of your cold. No? So something like that. It's important to be present.
Mhm.
It can be overwhelming, especially if they were diagnosed very advanced na. They do have a lot of meds they have to take, so they need a treatment partner sometimes to remind them, oh, you have to take this. Be patient also with if you're taking care of your relative or if you're a caregiver in the healthcare profession, be patient with the person with HIV. They're undergoing a lot of things and they don't need you to add to their stress. Kumbaga. So, if they have some difficulties with compliance, you just have to remind. Minsan ako guilty. Sometimes you get impatient. Then, well, I just told you this yesterday, but you really just have to be patient with them, and your presence especially would do wonders, no? Kasi I find that my patients, where they have their families with them consulting together with the patient, syempre there's another one who's also taking note of the instruction. So parang the burden is shared
Yes.
within the family. Hindi yung feeling nung patient parang it's me against the
They're
world, no?
alone.
And they're isolating themselves and having to undergo these issues by themselves. Now, for the general public, kasi nga, when we talk of HIV, parang ang dating kasi nila ginusto mo.
Yes.
That-
They're
that's a common-
judgmental. Nah, you
It's a
must.
common line of thinking. It's your fault that you got it. But me, I'm an infectious disease practitioner, and it's like any other infection. No, you just happen to have the exposure, the risk, and you acquired an infection. And this is not a punishment from wherever. It's a virus, no? So, and you just happen to get infected with the virus because of the exposure that you had. So, it should not be an issue of whether they did something good or bad. They are sick.
Yes.
They got an infection, and this is something that is manageable and can be controlled. No? It's actually easier to manage than diabetes, I find.
Wow. Okay, no, because take the
Yeah,
meds.
kasi if they're taking their meds, then if they're taking it regularly, then you're guaranteed that it's a good outcome. If for diabetes, even if you're taking your meds, you just ate leche flan today and then wala na. Your sugar is, di ba?
The diet.
Wala na ulit. So, it's not just taking the meds, it's also the diet and all these things. But for HIV, if you're on the meds regularly without fail, daily, then you're good. And you can live normal life.
Doctor, I'd like to emphasize something you said, which is that you shouldn't be afraid if you don't have AIDS or HIV. You shouldn't be afraid that you'll get it just by hugging or kissing the person who has HIV or AIDS. In fact, they should be more afraid of you, especially if you're an inconsiderate person who goes sneezes on them or coughs and doesn't. We have a lot of that. So much. Even just with COVID, you're like, can you please do not? Anything actually, and these things that you take for granted, or your own health, because your system is okay, your immune system is okay, you might pass it on to them. So in fact, they should be more like, are you clean? Instead of you asking them if they're clean. As you said, it's not a punishment. It's not like some filthy disease or something. And you actually need to you need to make sure you don't give them something rather than them giving you something. And the hugs and all of that's important, especially to people who generally enjoyed hugging and affection beforehand. I do want to mention Princess Diana, celebrities.
She said something about it. Yeah.
Yes, but she was one person who really did open many people's eyes and changed the way. That's one of the ways she changed the world. Respect. And then, aside from all the other celebrities and all that, that woman did a lot for AIDS and for battling AIDS. And so, okay, is there anything else you'd like to say, Doctor? I'm told we're running out of time, and the floor is yours.
Okay, so just know that HIV is something that can be prevented. And the access to these services, if you feel that you are at risk, or even if you don't feel you're at risk, you just want to know your status, you can get tested. In our center, we do offer HIV testing. PrEP is also available in Makati Med, and there are other treatment centers where you can acquire it. You just do a search, DOH accredited HIV treatment hubs. And then you will have a long list of facilities where you can access HIV care.
Okay. Thank you so much, Doctor. Thank you for sharing your time and your effort and your vast intelligence and knowledge about the topic. You're very articulate today. You explained a lot of things really well. And I think I really hope your message gets out to people, because I think you hit it on all levels. The medical facts, you are being a doctor, but you're also being very compassionate, and you understand all the facets of it, from psychological to physical. So thank you for being on the show again. Please do come back soon and discuss another topic of your choice with us. I'll be waiting for that. I'm looking forward to it. Is there anyone you'd like to say hi to before we go?
I'd like to acknowledge the staff of Makati Med CTTM for their hard work. Thank you.
I'd like to acknowledge you too. Thank you. Thank you, Makati CTTM, for your hard work, and also doctors like yourself, Dr. Quek. So folks, today we talked about HIV and AIDS. Hope it filled you with love somehow, and compassion, and more information and understanding. Thank you for educating me today, Doctor. And we'll be back next week with another episode of Healthline with Makati Med. So again, tune in next week for that. And in the meantime, everybody, take care of yourselves. And Doctor, thank you so much.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the